Deanna, and this is Stephen Ryan, and we're just delivered our third baby, Cole Ryan, and we're at Overlook Hospital in Summit, New Jersey.
We're aware of that there's not much medical concern of doing it versus not doing it. What was more important to us is that since I was circumcised, and any parent knows when you have little children, your bathroom time will not be by yourself. The kids will be there and seeing you, and it will be hard to explain why daddy looked one way and the baby looked another way.
You guys ready? Ready. All right, let's do it. All right, see you in a few minutes.
Goodbye, Mommy.
I have no concern.
No, we're 2 for 2 so far, so I'm sure we'll go 3 for 3. All right, buddy. Good luck.
The history of circumcision dates back to biblical times. Specifically, it was first noted in Egyptian time. Most likely, it was done for hygienic purposes. Nowadays, most patients find out whether they're having a boy or a girl by the middle of the pregnancy. And more often than not, the patient asks me, who does the circumcision, or does the circumcision have to be done? Some people think it's a law that it has to be done, and I tell them, no, it's your decision. And we do sometimes talk about it during the pregnancy, but more often than not, it's a decision that's made after the delivery, and with any surgical procedure, a consent has to be signed by the parent. The medical benefits of circumcision are many. Firstly, it decreases the number of urinary tract infections, especially in newborns and young children. The average risk of bladder infections in the first year is about 1 in 1,000. The uncircumcised child has a risk factor of about 1 in 100. So that is significant. There is a lower incidence, although it's a rare occurrence, of cancer of the penis, is usually more effective. The protection is more effective if the circumcision is done at birth as opposed to waiting if the child is 1 year or 2 years old. In the course of time, it continued with Jewish people having it for religious reasons, the bris.
Today we're going to be performing a bris on a little baby that is Jewish, and he's having his circumcision on the 8th day. It's a religious ceremony, and basically a bris is a covenant between the Jewish people and God.
It's important to follow tradition for reasons of Jewish faith and keeping traditions alive. Am I nervous? No, I'm excited. I'm happy for him that he's going to be going through this. Because it's something that we all do.
I happen to be a physician, so I put a cream on the baby's private that numbs the skin, and it makes it a little easier for him to go through the circumcision. If the baby's comfortable and we give him the sweet red kosher wine and you kind of have Grandpa holding him gently, it usually goes hopefully smoothly.
May God reach out to you in tenderness and give you peace and shalom, and may that be God's will.
Amen. In the Middle Ages, Christianity looked at circumcision as a method of preventing certain diseases such as syphilis, seizures, tuberculosis. So it's a very interesting history. The procedure of the circumcision is a very short procedure. Initially, the baby is put on a sterile board so he's not interfering with the procedure itself. The penis is cleaned with betadine. Following this, we give an injection of local anesthetic in the penis itself on a nerve that goes to the tip of the penis. After this, an instrument is used to free up the foreskin from the tip of the penis. And when that is done, the foreskin is pulled away from the tip of the penis, and a clamp is placed gently in front of the tip of the penis, and the excess skin is cut with a knife. The baby does not feel this once the anesthetic is in place. Following this, we leave the clamp on for a few minutes, release the clamp, push the skin forward, exposing the tip of the penis. A sterile dressing is applied. The diaper is placed on the baby, and the baby goes back to the mother, and the whole procedure takes less than 10 minutes.
With having our third boy and him being circumcised, we already knew what to expect.
And the aftercare, too,
yes,
of what was necessary for the parents to do to take care to make sure it heals properly.
But it heals very nicely in about a week's time.
There's no right or wrong answer. It's an individual decision by the parents, and whatever decision is made is the right one.
Thank you for watching Parents TV, Our Families, Our Lives.